This is Chip Maxwell, and you're listening to the Retire Smart podcast with David Brooks. This episode dives into the growing financial strain on Medicare and what it means for retirees. David and financial advisor Jacob Orand explain how IRMAA surcharges, rising premiums, and legislative risks are creating hidden taxes, and share strategies to help protect income and avoid unnecessary penalties in retirement.
Joining me in the studio once again is our resident authority on all things that are Medicare and some success penalties that come along with Medicare. You're going to hear more about that today, called IRMAA. Jacob, how are we doing, brother?
I'm doing fantastic. Thanks for having me.
No, thanks for stopping in this week. You've been extremely busy servicing and helping a lot of our clients. As Chip and I were mentioning in the first segment, we had our annual September speaker series, and I think you were one of many of the employees that gave us that was the best one yet from the feedback, as long as the feedback we got from so many of our clients. And we did have over 100 folks that are not our clients from our listening audience here attend the event, and it was fantastic. So hopefully you enjoyed that. And be sure to reach out if you're one of those 100 and let us know, what you thought of the event if we didn't capture you on the QR code there. But anyway, so obviously Becky talked about legislative risk, and I talked about, I'd shared stages with her across the country. And for our listening audience, Becky is considered one of the leading authorities on what we call legislative risk. She kind of coined the term, frankly, and she's worked in D.C., she's worked in the White House, she spent a couple of decades. She really understands the process and the reality that it's not necessarily right versus left, it's math. And then politicians don't want to address math. They want to address the only math they care about. How many votes do I get in my next election cycle? So they don't necessarily always want to do the hard things and fix these problems. The problem with that is now we have tons of retirees that have done everything they thought they were supposed to do, saved up their dollars, and feel like they're good to go. In fact, they walk in and they're like, am I okay? And well, you are, except for some of these success penalties, as I sometimes call them. So talk about a little of the legislative risk, what you got out of that speech in the areas that you help us focus on.
Wow, yeah, she gave us some really great insight on so many things that legislative risk and those things that retirees can face. One of the areas that she spoke about was legislative risk when it comes to IRMAA. For those of you who haven't listened to the show before or may not know, IRMAA is that monthly surcharge that they're going to put on your Medicare Part B and D
She's
premiums.
She's like the bad relative. Aunt Irma, as we sometimes refer to her, shows up and stays longer than fresh fish will stay alive.
We call it the IRMAA, kind of a hidden penalty tax.
Yeah, you're penalized because you're blessed with what the government deems too much income. And we're not talking about exorbitant amounts of income in 2025.
Yeah, exactly. Now, there are two key areas that she talked about for Medicare. So there's two trust funds that actually fund to pay for Medicare. The first one is the Medicare Hospital Insurance Trust Fund, and that covers Part A. So if you go to the hospital and you pay your small deductible, they're going to cover the rest. Well, Part A, according to recent data, is that trust fund is anticipated to be completely depleted by 2036. That is scary.
Yeah, it is.
All right. So the second one is the Supplemental Medical Insurance Trust Fund, also known as
B, right?
SMI. Yeah, that covers Part B and Part D. Well, unlike the Hospital Insurance Trust Fund, the SMI receives their funding from general government revenues, and the premiums that beneficiaries pay. Well, I don't know if you heard, David, but our government has a crazy spending problem.
You don't say.
It's the first time hearing of it.
What?
So that general revenue is being spread extremely thin, especially when the majority of our revenue is going to pay off the interest on our national debt.
Well, speaking of that, right? So the last fiscal year, so we're in 24. So actually, we had just one ended, but the data she gave was from the fiscal year ended in 24, and she actually covered that, right? The government took in that year $4.9 trillion in revenue, and the mandatory spending, Medicare, Medicaid, and Social Security, right? Just the mandated obligations was $4.9 trillion. None of the appropriations. We didn't get into interest, income, defense spending, et cetera, right? So, and then this past year, it was, we have the final numbers coming up, was just over $5.1 trillion in revenue, which is just amazing to me. But again, we overspent by $2 trillion, and we're on course to overspend by like $2.3 trillion in the rolling forward 12 months. So what does this mean for our audience?
Yeah, that's where that legislative risk comes in that Becky and you were talking about. So the government's going to have to start pushing more of that cost onto Medicare beneficiaries. Well, there's a couple of ways they can do that. The first one is increase the monthly premiums,
which they have done significantly. So just 3 years ago, those premiums were about $135 and like 90 cents, $136. Today they're at $180 to access Medicare. And again, lots of politicians and a lot of people in the political spectrum, we should have Medicare for all. And I'm like, just ask any senior, is Medicare free? I just want to make sure people understand what they're actually asking for.
Yeah.
And two, it's not funded, as we just talked about. So how would you pay for that? But anyway, so and unfortunately, you're probably going to tell us just how bad that 180, which is already up almost $50 in the last 3 years.
Yeah,
it's going up significantly higher next year, right?
Yeah. Expectations and projections are going to say it's going to be well over $200, probably around $206 just for your Part B. And that's
so if you're a married couple, that's $412 a month just to access the health care that you were promised or paid your whole working career for.
That's right.
And then you got out-of-pocket costs, and then you can buy a supplemental policy, et cetera, et cetera.
Yeah. So there's another way that they could possibly do this is increase those IRMAA surcharges and those IRMAA taxes. So right now, the higher income that you bring in, the more you pay. Well, they're just going to want you to pay more and more and more to help fund those programs.
Well, and that's the other thing is they don't grow the brackets where these income lines go in at the same rate as inflation. They actually use a little side inflation number called CPIW, which grows slower, mathematically designed, so that they can get more people to cross a line and pay more revenue in. These are what I call the hidden penalty taxes, and they are, in fact, a tax. And so we just want you to be prepared for that, right? So they're pushing people into higher brackets. The other thing is the penalties once you go over, they don't go up with inflation either, do they? In fact, it's over twice 200% actual inflation since 2004 when this law was put in place, right?
Right. They just continue to increase those taxes on you. So every single year, your insurance premiums are going up much faster than you are getting in your cost of living adjustment for Social Security.
During the Q&A session with Becky, I was on stage at the speaker event we're talking about, and somehow that was brought up, and I actually talked about, some people are successful in life and they walk in retirement, and nobody told them that they're going to have a $1,200 Medicare bill. And I was actually staring at the client I was talking about in the audience, and he just started laughing because, Bob, I'm talking about you. He was literally just like, oh my gosh, that's exactly right. Because he'd walked in only about 2 months before his retirement for his planning with us. He hired us, but we didn't have time to do some of the things you're going to talk about at this class. So the point being is, listen, I know it sounds like doom and gloom coming out of our mouth right now, but we actually have a class where we're going to teach you what the likelihood of these penalties are to continue, how the system works, but we're also going to have you understand there are things to do that you can reduce this. Even if you're paying IRMAA penalties now, you can take action so that maybe in a couple of years you don't have to do that, because once you cross this threshold, most people have what we call forced income, and their income's not going to go down, so they're going to pay these penalties, and in fact, they start to go other lines. And of course, man, we don't even get into what you get in the class. If you're married and you lose a spouse, you typically are jumping another 1 or 2 penalties, right?
That's right. I, in fact, just had a client meet with me last week, and he had unfortunately lost his spouse. If we hadn't done the pre-planning and the Roth conversions and all the things that go into that financial plan, he would be in what we call the widow's dilemma, where he would have been in higher tax brackets. He would have been paying extra Medicare premiums. But through our planning, we get to avoid all of that.
Man, I got to tell you, there's a lot to learn about this. So I also want to point out that you actually have a certification. You are an IRMAA certified planner. I believe that's the technical term, right, for the certification. You, along with one of the other advisors on our team, kind of teach this class together. You give out a ton of valuable information. It was highly regarded the last time you guys did this. So when is this class?
Yeah, absolutely. So this is going to be September 24th at 6:30 in the Midwest Learning Center, right next here to Retire Smart.
Okay, so that is, you need to register. I would tell you, we have standing room only sometimes at these classes. Go to retiresmartnow.com, click on the attendant events page, or simply call the office to attend. What other nuggets do you got for our audience this week, bud?
Well, hey, I don't want to give too much away. I would love for everybody to attend that class. Alex Murray and myself will be there. We try to squeeze as much information as we can.
Alex Murray's going to be there? Well, you may not want to attend after all. I'm just kidding. Alex, now we're just testing to see if Alex does his homework and listens to the show this weekend.
Well, I hope to see you guys there.
All right. Thank you so much for stopping in the studio, Jacob.
Thanks, David.
Thank you for listening to the Retire Smart podcast with David Brooks. If you want to learn how to generate lifetime income, reduce your tax bill, and maintain your lifestyle in retirement, visit retiresmartpodcast.com. And make sure to subscribe to keep up with new episodes every week.